Greetings, Lake Providence Church family. I pray that this finds you healthy and safe as we continue through this pandemic. As you may already know, the Praise in Purple Alzheimer's Observance was moved to next Saturday, 10 a.m. on Facebook Live. That's August 29th. See you there in purple for Alzheimer's Observance. Let's just talk about a few COVID-19 facts. First of all, Nashville's COVID-19 metrics show some stability and improvement. It is expected that all of the COVID-19 metrics for Nashville will stay stable and be improving before moving on to another stage or phase of our reopening plan. We are hopeful as the Nashville community continues to mitigate the spread of this disease. Studies show that children are more likely to be asymptomatic and have less morbidity and mortality from COVID-19. That means that if infected, they may not show symptoms as often, or they may not show symptoms at all. Children will develop severe illness and require hospitalization less often than adults. Most children will survive COVID-19. Children also have a larger viral load or viral count and are believed to transmit the virus more easily to others. That is why we need to make sure that we teach children to keep themselves and others safe. There was an increase in the number of children with positive COVID-19 tests in June and July. This leveled off the beginning of August, so we'll see how we do toward the end of August and after that. There's less testing being done right now. We're not sure exactly why that is, but we believe that fewer people are having symptoms. Maybe that's a good thing. Hispanic Latino children comprise 25% of all child cases and 16% of adult cases. African Americans comprise 18% of child cases and 20% of adult cases in Nashville. Our Hispanic Latino population is more likely to live in multi-generational homes and share toilets. Social distancing and quarantine may not be possible in their homes. The data indicates that the largest number of Nashvillians infected are age 45 and under. They may be asymptomatic and still spread the disease. This age group has the least morbidity and mortality. In other words, they get the milder forms of COVID-19 and are less likely to die. But they are more likely to spread it to the elderly and the vulnerable, who are more likely to have severe disease and not survive. COVID-19 infects men and women aged 19 to 64 equally, but more female cases are noted over the age of 65. Males have a tendency to get a much more severe form of the disease than women. White Nashvillians comprise more of the positive cases as expected because they comprise the majority of Nashville's population. However, more of the COVID-19 deaths occur in the Black and brown COVID-19 patients, even though they are a smaller percentage of the population. This is believed due to the differences in healthcare and the disparities that we now know have been really uncovered by COVID-19. We now see long-term effects of COVID-19. Some COVID-19 patients have cough, trouble breathing, fatigue, fevers, loss of taste and smell, and even other symptoms for weeks to months after recovering from the acute infection. Herd immunity was thought to be a way to handle COVID-19 by some, For herd immunity to occur, enough people would have to be infected, recovered, and develop antibodies so that the virus no longer has anybody to infect. Everybody would be immune, and just as though we had all had the virus, the vaccine. The problems with herd immunity are about 70% of the population needs to survive the infection and become immune for it to stop the spread of the virus. In order to get enough people with antibodies, millions of people will have to die as we wait for enough people to get infected, recover, and become immune. In America, over 200 million people would have to get infected, and over 500,000 would die from COVID-19 trying to achieve herd immunity. Under those circumstances, herd immunity would not even be reached until after 2021. The antibodies or the immunity may even be temporary and only last for a few months. So the risk of herd immunity is much, much greater than the benefit as an approach to controlling COVID-19. In years past, some parents thought it was a good idea to expose their children to chickenpox so that they would have a milder form of chickenpox or varicella, which is the virus, while they were younger, because it's worse when you get older. This gave rise to the COVID-19 parties. I'm sure you've heard of those. During these parties, young people exposed themselves to the virus hoping to get infected and become immune. COVID-19 is much more contagious and deadly than chickenpox. This is not a virus that anyone should intentionally expose themselves to. COVID-19 parties not only cause infection, but can cause severe illness and death. Those people who attend COVID parties not only risk their lives, but the lives of all whom they physically connect with, especially the elderly and those with health risk of any age. So right now, what slows the spread of this disease? You got it. Good hand washing, wearing masks, social distancing, covering our coughs and sneezes, avoiding touching our faces, especially our eyes, nose, and mouth, avoiding crowds, and for Nashville, that's 25 or more, staying home as much as possible, especially if sick, over 65, and with health risk, regardless of age. Let's keep doing what we know to do to slow the spread of the disease. In the meantime, be safe, be healthy, and stay prayed up. Have a blessed week.